At the Hamlet Rehabilitation and Healthcare Center in Nesconset, a rare Level 4 citation from the New York State Department of Health in early September under the classification immediate jeopardy as a result of the death of a resident here who had a history of gastrointestinal issues.
They found that this resident had unfortunately had constipation, and that there was no evidence that the facility undertook any of the protocols or processes, even its own protocols, to ensure that the resident was able to frankly have a bowel movement.
The state health department determined nurses failed to address the resident's lack of a bowel movement for at least a week. It's a failure to provide proper staffing, according to Richard Mollett, Executive Director of the Long-Term Care Community Coalition, an advocacy group for nursing home residents.
According to that substantiated citation from the New York State Department of Health, this was something that went on for a significant period of time, shift after shift, where there was just not the evidence there that people were taking the appropriate care or precautions to ensure that this resident was treated humanely.
New York and New Jersey tend to be among the lowest nationwide in terms of identifying when a resident has been harmed or put in immediate jeopardy, according to the Long-Term Care Community Coalition.
We see a real inability or unwillingness to identify when residents have put in harm or immediate jeopardy, which in this case makes it all the more striking because it happened here. It's one of those rare instances. So in our view, it really means that things were extremely bad.
The Hamlet Rehabilitation and Healthcare Center, owned by Care Right Centers, which operates 5 Long Island nursing homes, tells Newsday it has formally disputed the state's determination and says all relevant protocols were in place and implemented during the patient's residency. Steve Langford for NewsdayTV.